student, there is some technical problem. So we will continue about the skeletal system in the orthopedic. In that there is a brief anatomy. Then second point is the organization of the bones, types of the bones, about the joints, fibrous joints, cartilaginous joints, synovial joint, or diarthrosis and its types we will learn in the skeletal system. So briefly we see the anatomy of the bone and its development. In that we will study that bone is a specialized connective tissue, and by providing a rigid skeletal it gives the all important shape to the human being. So it's proud to be entrusted the job of protecting the vital structures like brain, lungs and heart. So, when we study about the bones, bone is a rigid skeleton of the human being, and it gives a very important structure, that is brain, lungs, and heart. So, it supports to the brain, heart, lungs, and the various important organs of our body. Second one is bone are the largest storehouse of the all important minerals like minerals, calcium, and the other important component of the body, and also concerned with the hemopoiesis. So when we study about the development of the bone, we can see that bone is the largest storehouse of all important mineral calcium of the body and concerned with the hemopoiesis, that is formation of the RBCs. It gives an attachment to the muscles and enable them to act on the joint by acting as a lever on their action. So, bone gives attachment to the muscles and to the many other organs that act on the joint by acting as a lever for their action. And it made up of 30% organic material, mainly type 1 collagen, and 70% mineral, that is the calcium hydroxy. So, bone are made up of 30% of organic material and 70% by the mineral. So, when we study about the development of the bone, it is a specialized connective tissue and it gives a rigid skeleton. So, it protects the brain, lungs, heart, and the many vital organs of our body. And it is the largest storehouse of all important minerals, calcium, in our body, and it concerns with the hemoglobin. Then it gives attachment to the muscles and enable them to act on the joint by acting as a lever, and it is made up of 30% of organic material and 70% of the mineral. Then when we study about the functions of the bone, then mainly the bone gives the protection of the vital organs. It supports to the body, hemopoiesis, then it gives movement and locomotion, and final there is a mineral storage. So these are the important functions of the bone, that is the skeletal system. First one is the protection of vital organs, support to the body, hemopoiesis, movement and locomotion, and the last is the mineral storage. So when we study about the development of the bone, development begins with the condensation of the mesenchyme in the embryo. There are certain exceptions like a vault of the skull, that is the membranous ossification, and the clavicle, that is the mid, and the mandible is the Michel's curve. So the development of the bone is begin from the mesenchyme in the embryo, and certain the exceptions of this is the skull, clavicle, and the mandible. From These condensation it rapidly form a cartilaginous model. So, between the cartilaginous bones and plates, it forms a small clip for the fracture future joint. So, from this condensation, bone rapidly form a cartilaginous model, and between the cartilaginous bones and plates, it forms a small clip for future joint in the embryo. So, during this period of 12 weeks, that is the gestation period of first 12 weeks, is particularly vulnerable to the teratogenic influences. So, it's mostly probable to the teratogenic influences in the first 12 weeks of his life, that is in the gestation period of first 3 months. Then, as early as the fifth week of intrauterine life, it develops a primary center of the ossification. So, in the gestation period of the fifth week of intrauterine life, embryo develops a primary center of ossification which gradually replaces these cartilage and model to the bone by a process of endochondral ossification. So, firstly, in the fifth week, we can see the center of the ossification in the ultrasound sonogram. So, during the late fetal stage or early few years of the life, it develops secondary centers of the ossification. So, in the early few years of life or the late fetal stage, there is the secondary centers of the ossification are developed and growth plates that which keep the primary and the secondary centers of the ossification are separated from each other until the skeletal maturity. So it helps to grow longitudinally and it increases its width from the growth of the thickened periosteum. So, in addition, it keeps remodeling itself from the fetal stage to the adult stage, and only the rate varies 50% during the first 2 years of the life and 5% per year thereafter until the adulthood. So, this is about the development of the food. In that, we can see that how the bone is developed in a stage of the embryo to the adult life of as development begins in the embryo except skull clavicle and mandible then it rapidly a cartilaginous model and during the 12 weeks it forms a small cleft for the future joint. And in the fifth week of intrauterine life, that is in a pregnant woman, in the gestation period of the fifth week, it develops a primary center of ossification and which gradually replaces this cartilage and the model to the bone. So, by the process of endochondral ossification. And during the late fetal stage or the early few years, so early few years of life of a baby or in the late fetal stage of a baby, it develops the secondary center of the ossification, that is the growth plate. When the secondary center of the ossification is formed, there is a primary and secondary center of the ossification are separated from each other. So they separate from each other until there is a skeletal maturity. So until there is a skeletal maturity come, it separates from the each other, that is primary and secondary center, and help it grow longitudinally. So they grow longitudinally and it increases its width. So when growing is occurs of the bone, the width is increased from the growth of the thickened periosteum. So from the periosteum becomes thick and then width is increased. And in this addition, there is a remodeling of itself of the bone from fetal stage to the adult life is occurred. So 50% during the first 2 years of the life is remodeling of the bone is occur and 5% per year thereafter then bone development is occurring in the first 2 years of the child. And then every year, as 5% is bone development is occur until childhood, until adulthood. So remember that the bone development start as a condensation of the mesenchyme and later a cartilaginous model is built. So there are the two types of the ossification, that is endochondral and the membrane. And there are the three types of the bone cells. So in this brief history about the development of the bone, the most important point as to remember as a clinical point of view that bone development starts as a condensation of mesenchyme, then later a cartilaginous model is developed. Then there are two types of the ossification, that is endochondral and membranous, and there are three types of bones. So which are these three types of the bone cells? The first one is the osteon. So when we study the osteon, what is the osteon? That bones are made up of many units internally called as osteon. So bone is made up of many units internally. Internally it is made up of the many units. So these are called as osteon. It has three types of the cell, that is osteoclasts that form the bone, osteoclasts which remove the bone and are concerned with remodeling, osteocytes which are the resting cells. So these are the three types of the cell. First one is the osteoblast, then osteoclast and osteocyte. So osteocytes that form the bone. The formation of the bone is occurred due to the osteoblast and remove the bone. Osteoclasts, which are the uh, parts which are remove the bone and which concern with the remodeling. So remodeling necessary, remodeling require osteoclast, or due to the osteoclast there is a remodeling is and osteocytes. So which are the resting cells? Osteocytes are the resting cells. So there are three types of the cell: osteoblast, osteoclast, and osteocyte. Say then these cells are present in the lamina and which surround concentrically the Volkmann canal, which has the nutrient vessel, and each lamina is interconnected by the canaliculi through which the nutrient passes. So how the nutrient is passes from a mother to the embryo is that by this way, that is the from the Volkmann canal. So these cells are present in the lamina. That osteoclast, and osteocytes are the cells are present in the lamina and is surrounded by Volkmann canal, that is has nutrient vessel, and each lamellae is interconnected by the canaliculi. So these lamellae are connected with each other as interconnected by the canaliculi, and which is the nutrient path through which canaliculi the nutrients are passed. So which help to grow of the bone. Then osteoblasts lay down an uncalcified matrix which is subsequently calcified as a true bone. So osteoblasts are laid up an unclassified matrix which is subsequently classified, calcified as a true bone. So there is a formation of the true bone by the osteoblast. These various osteols amalgamate to form a large Haversian system and loosely woven in the medullary bone and densely packed in the cortical shape. So these various osteols are important in formation of the Haversian system, loosely woven in the medullary bone and densely packed in the cortical shape. So this is you already study in the first year of the PhD. Then now having known its intrinsic structure, it has a two major portion, that is the medulla and the cortex. So next topic is the medulla and the cortex. So So what is the medulla? Medulla is a softener counterpart and has the dual role of the structure and the soul. So medulla stores the more than the 95% of the body calcium, and it is a storehouse for the other minerals, and the important component of the medulla is the marrow that is between the medullary bone length, and this is the source from where RBC and WBC originate. So, medulla is the most important part of the bone where the RBC and WBC are originated. So, initially present throughout, and it confines itself to the metaphysical region of the long bone and in some flat bone like pelvis and knee. As the age advances, it is replaced by a fatty white mass. So, as age of a human being is advanced, there is a replace by in a fatty white matter. The medulla plays the structural role by its trabecular organization along the maximum lines of the space and clearly identifies itself into the compression and the traction capability. So, when we study about the medulla, firstly, medulla is a softer counterpart. So, has a dual role in the structure and the structure. So it stores 95% of the body calcium. So remember that 95% of the body calcium is stored in a medulla of a bone. So it is a storehouse for it is the main storehouse of the calcium as well as the mineral. And the most important component of the medulla is the marrow. It is between the medullary bone lattices. The marrow is present in between the medullary bone lattices, and this is the source. So, in the medulla, there is RBC and WBC originate in the marrow that are present in the medullary bone lattices, and initially it present throughout, but it confines itself in the metaphyseal region of the long bone and in some flat bones like the pelvis or rib. So, rib, pelvis, these are the flat bones. And the age advances is replaced by a fatty white matter. So the medulla plays structural role by the trabecular organization along the maximum lines of the space and clearly identify itself into the compression and traction plane. So when we see the bone cross section and its internal structure. So this is the internal structure of a bone when we cut the bone in a cross section. So this is a diagrammatic representation of the internal structure of the bone in that the external part is that periosteum. Just under the periosteum, there is the external circumferential lamellae. So these are 1, 2, and 3. These are external circumferential lamellae just under the periosteum. And under that there is osteon. So these are the osteon. Okay. Then this is the central canal of the bone. These are the trabeculae of the spongy bone. This one is also central canal. This is the perforating canal. This central canal lines are perforate here. So this is perforating canal. These are the blood vessels and these are the perforating fibers. So remember that medulla is a softer portion. They store 95% of the body calcium and marrow is the most and the other important component, and it also plays a structural role. So these are the points to remember that what is the medulla. So next is the concept. So when we study about the cortex, cortex gives the remarkable strength which admire particularly during the compression, and its periosteal cover allows a remodeling throughout the nerve. It also gives attachment to the ligament, tendon, and muscle through the sharp spine. So, cortex gives us remarkable strength. The strength of our body is due to the cortex, and which admire particularly during compression. So, when there is a compression, you feel that there is strength, and which is due to the cortex. So its periosteal cover allows remodeling throughout the life. There is a remodeling of the cortex is occurs throughout the life, and it also gives attachment to the ligament, tendon, and the muscle through its sharp fibers. The cortex has the sharp fibers through which it gives attachment to the ligament, muscles, and tendons. Then the general structure. So generally it has an epiphysis and epiphysis plate, which disappear with the growth, and metaphysis and the diaphysis. So when growth is occurred from childhood to the adult, the epiphysis and epiphysis plate is disappeared, and metaphysis and diaphysis is released. So, firstly, when we see the epiphysis, it is an expanded portion at the end that develop usually under pressure and form a support for the joint surface. So, epiphysis is expanded portion. It is expanded portion at the end, and at the end it develops usually under pressure and form support for the joint surface. So when there is a joint surface, the epiphysis gives support to that as an expanded portion. It is easily affected by the developmental problem like epiphyseal diaphysis, trauma, overuse, degeneration, and when there is a damaged blood supply. So it is easily epiphysis is easily affected by the any developmental problem like epiphyseal dysplasia, when there is a trauma or the overuse of the any bone, or when there is a degeneration or the damaged blood supply, which leads to the developmental problem in the epiphysis. That result is distorted joint due to the avascular necrosis and degenerative changes. So the degenerative changes and avascular necrosis is seen in these distorted joints, that is in the epiphysis. Second one is the growth plate. The growth plate, that is the physis. Through the mechanically weak it and help a longitudinal growth. So growth plate is help for the longitudinal growth of the foot. It will respond to the growth and sex hormones. It is affected by the conditions like osteomyelitis, tumor, slip epiphysis, resulting in a short stature or deformed growth of the growth arm. So the growth plate is held for longitudinal growth and to respond the growth and it, for the sex hormone, and is affected by the conditions that are osteomyelitis, tumor, slip epiphysis, and resulting in a short feature or the deformed growth or growth. So this is about the growth plate and the epiphysis. So here we see the general structure of the long bone, that is, this is the long bone, that this is the femur. In there is epiphyseal line, that this is the epiphyseal line, this is epiphysis, this is the calcareous of the bone, This is a medullary canal, and this one is a cortex. So in that we can see the diagrammatic presentation of the general structure of the long bone shows the cortex, medullary canal, calcaneus bone, epiphysis and epiphyseal line. Then next one is the metaphysis. It is concerned with the remodeling of the bone, and it is the calcaneus portion and heel flap. It gives attachment to the ligament and the tendon, and it is vulnerable to develop osteomyelitis, then dysplasia, and the tumor resulting distorted growth and altered bone shape. So, metaphysis concerned with the remodeling of the, so it has an important role in the remodeling of the bone. When there is a calcaneus portion that heals rapidly and it gives attachment to the ligament and tendon, and it is vulnerable to develop osteomyelitis, dysplasia, tumors, and resulting in distorted growth and altered bones. And next is the diaphysis. So, diaphysis, it is a significant compact cortical bone which is the strong in compression and which gives origin to the muscle. So diaphysis gives origin to the muscle and it which is a strong in compression. Diaphysis forms the shaft of the bone. So this shaft of the bone is formed due to the diaphysis, and healing is slow when compared to the metaphysis. As compared to the metaphysis, the healing process is slow in diaphysis. And in remodeling, it can remodel agglutation but not rotation. And it may develop a fracture, dysplasia, infection, and rarely the tumor. So, in the remodeling, it, diaphysis can remodel agglu- agglutination but not rotation, and it may develop the fracture, dysplasia, infections, and rarely the tumor. So, when we study the development of the bone, the most important point to remember are that the part of the bone, that is epiphysis, physis, that is growth plate, metaphysis, and the diaphysis. So these are the parts of the bone as we remember in a development of the bone. Next is the organization of the bone. So in that, when we study about the organization of the bone, we can see there are total bones are 206 in number and are grouped into the two subdivisions which are namely anastomosis. Like firstly, the axial skeleton which contains 80 bones, then appendicular skeleton which contains 126 bones. Axial skeleton form the upright axis of the body. The appendicular skeleton form the appendages and the girdles that attach them to the axial skeleton. So, out of the 206, some of us are short and some are the long, and they have the different shapes. The shape and the size depend upon the function of bones. So, in the organization of the bones, there are totally 206 bones. In that, 80 bones are axial skeleton and 126 bones are appendicular. Axial means